Hello, I'm Dr. Rangi. I'm a board-certified endocrinologist and I practice in Sacramento, California. I wanted to talk about a topic that is very dear to me and I see it every day in my practice. It's polycystic ovary syndrome. Polycystic ovary syndrome is a constellation of symptoms that we see in young girls most of the time. Could be teenagers, could be in early 20s, who may not even know they have the condition and may go to their doctor because of either irregular periods or they may have excessive acne or excessive facial hair or body hair. Those are the typical symptoms, but it is also a very common reason for infertility among young women. 7 to 10% of the population in the United States has polycystic ovary syndrome. Again, very common cause for irregular periods and infertility. Treatment is available, but let's look at the causes for why somebody gets polycystic ovary syndrome. Polycystic ovary syndrome happens because of excessive male hormone called androgen. And why that happens is not clearly understood, but it is likely to be imbalance between the pituitary and the ovaries, where the regulation of androgen production is a little excessive. Also, there is excessive amount of insulin because of a condition called insulin resistance. And that insulin resistance happens, which can worsen the hyperandrogenism, and they can both worsen. It can be a vicious cycle. So what can we do about this? Environmental factors could be another reason, which can change the genetics of women. If it's not a familial, if it's not running in the family, it could be new onset in certain kids because of certain hormonal factors that change their genetics, and that's called epigenetics. So staying healthy is, first of all, very important. Staying active, keeping the weight in check, because even if somebody gets polycystic ovary syndrome diagnosed, the first thing we tell people to do is watch their diet, have limited calories, limit the carbohydrates, and be active and exercise every day. The other treatment depends on patient symptoms. So if somebody is looking for fertility, then the treatment is very different. If the fertility is not an issue at this time or a concern, then we usually start with birth control pills. And sometimes we add medications called anti-androgen therapy that can help with excessive facial hair or acne or whatever the concern may be. Also, women with polycystic ovary syndrome have very less periods. Usually they have 2 to 3 periods in a year, or they may get very irregular periods. And because of that, they are at a high risk for uterine lining hypertrophy or endometrial hyperplasia, which can translate into endometrial cancer. So very important that these women get their regular check, and also we need to put them on hormone treatment or birth control pills so that we can regularize their periods and they can shed the inner lining so the risk of endometrial cancer goes down. What other treatment options we have depending on the complications? Women with PCOS are at a high risk for diabetes. So if somebody has either early diabetes or diabetes, we treat accordingly. Also, there's concerns of excessive weight that can cause other complications, and that is again a part of insulin resistance. So if somebody has excessive weight, which not all women have weight issues with polycystic ovary syndrome, if they do have issues with weight, then the fat can deposit in the liver, causing abnormal liver tests, a condition called non-alcoholic steatohepatitis. So that is something we watch for. Excessive weight can also lead to a condition called obstructive sleep apnea. So if somebody has obstructive sleep apnea, they're not going to sleep well and will be fatigued and tired all day. So it's something that we should keep in mind as a possible complication of PCOS. Also, women with PCOS, because of their higher risk for weight gain, high risk for diabetes, they're at a high risk for cardiovascular disease. So we should periodically monitor their cholesterol. We usually tend to see they have low good cholesterol and a higher bad cholesterol called LDL. The ratio is altered, again, something that we treat with lifestyle if we can, and if we cannot, then we have to add certain medications. Sometimes you also add medications called anti-androgens that block the androgen functioning, and that can improve the problem with excessive facial hair. So depending on the patient's presentation, we decide what treatment to give. Make sure you check with your doctor if you have these symptoms. Get yourself checked. You may get some blood tests done in addition to your symptom presentation, and that helps us assist in the diagnosis. And if needed, you may get a pelvic exam with a GYN as well, if needed. Sometimes we do ovarian ultrasound as well. Some women have the actual cysts on the ovaries, but not all, and that's not needed to, that's not the criteria to have to diagnose a condition. So hopefully this was all very helpful for you. If you have these symptoms, or if your near and dear ones have these symptoms, please check with your doctor and get treated. We'll come back with some more information for you. Thank you so much for the attention.